What genetic tests are you referring to for EDS? Well, there's a number of genetic testing that can be done. One is called the KIT, K-I-T test. It's a gene. Let me see, it's D816V. And if you have a SNP or a mutation in that, it will predispose you to more symptoms of MCAS. Blood work, you can look at tryptase. That is kind of hit or miss. A lot of people have normal tryptase levels that do have MCAS. But usually, if you're above 20 nanograms per ml in your blood work, that's a positive. That can be helpful. Also, histamine levels, but you have to be off of antihistamines for a couple of weeks. DAO, diamine oxidase, which is an enzyme that breaks down histamine. If there's low levels of that, that may predispose you. Bradykinins, prostaglandins, urine methylhistamine, those are all tests that can be used. And if mastocytosis, which is similar but different to MCAS, is suspected, it might require a bone marrow biopsy. So those are some tests. Others, getting into the weeds, LTC4, VEGF, VEGF, tumor necrosis factor, TNF, and IL-5. Those are all things that doctors can use. I don't use a lot of testing. I don't like to over-test because some of the serology is just not 100%. And so if you present a patient with a negative study, they kind of take that at face value and say, well, that must not be the problem, and it can be missed. That's been my experience with Lyme disease. Very difficult to diagnose, and a negative test doesn't mean you don't have it.